was first called to come this morning and talk to you a little bit about the Center for Nursing Excellence, I not only thought it would be a pleasure, but I was also extremely honored. The Center for Nursing Excellence has, from the time of its vision and inception until the time that it began to operate, has just been absolutely amazing. I like to be a bit selfish and not only refer to it as a Center of Nursing Excellence, but also the Center of Nursing Excitement, if you will. And in this day and time, we need some excitement about nursing. As you can see, here is the entrance to the Center of Nursing Excellence, but before we talk about it, I think we need to talk just a little bit about healthcare in general. I'm sure it's nothing new to anyone in this room today that if you have picked up a newspaper, any type of trade magazine, if you have looked at TV at all, you realize that the healthcare industry is an enormous industry that is growing every day. And there are several reasons for that growth. As you know, we are an aging population, of which I'm proud to be a member. We also have baby boomers that as they begin to age and retire, their demands for health care are increasing. I'm also glad to be a member of that group. And at the same time, we have health care reform on the forefront, which if everything goes as planned, we will be administering and giving health care to people who have never ever had that opportunity before. So in order to meet all of these demands and challenges, we have got to have the appropriate workforce to do that. And the Center of Nursing Excellence is going to help us in this region to meet those goals and those demands. A few of the statistics that I just find to be absolutely astounding is the healthcare industry has added, since the recession began in 2007, 613,000 jobs. In November of 2009 alone, when there were other industries that were having layoffs across the nation of 85,000 positions in 1 month, the healthcare industry was actually adding 21,000 positions in that 1 month. It's amazing, isn't it? Of those positions, there will be 233,000 additional jobs for registered nurses each year through 2016. That's in addition to the existing 2.5 million RN positions across the nation. In the year 2009, we had 200,000 RNs who entered the workforce. Of course, if you do the math, you quickly see that the critical shortage that's predicted and that is discussed so very much is truly there, because we need almost twice as many nurses as we are producing on an annual basis. But that's only half the story. Nursing aides, orderlies, attendants, and home health aides are among the occupations adding the most new jobs in the healthcare industry between 2008 and 2018, for a total of almost 600,000. So as you can see, that even outweighs the need for registered nurses. I think we also need to talk about that, a lot of times when we talk about nurses and healthcare providers, we automatically think of hospitals. Hospitals are not the only people that are employing these individuals. You have your hospitals, you have home health agencies, you have physician offices, you have rehabilitation centers, you have long-term care. There are all sorts of needers of healthcare providers out there, if you will. The Southern Virginia Higher Education Center, with its Board of Trustees and the members, quickly recognized the need that we would have for nurses, nursing assistants, and those types of providers. And they came up with a concept, or I also like to refer to it as a vision, in 2007, that what could we do in this area to make sure that we could meet these needs. They quickly formed a committee that talked about all of the needs and what we felt like we could do. Quickly looked for partners who could help us with the funding. We were fortunate enough to have the Virginia Tobacco Commission, the Halifax Education Foundation, the United States Department of Agriculture, as well as private benefactors who were willing to help us with this effort. The center opened in September of 2008. It was a $1.6 million facility. over 4,100 square feet of state-of-the-art technology. And then what we did with our partners from higher education is we are now able to provide programs for nursing assistants through candidates for the Doctorate of Nursing Practice. It's been amazing what they have been able to accomplish. This just kind of gives you an idea of what the Center of Nursing Excellence does. Of course, we have, as I've mentioned earlier, the degree conferring partnerships. We actually have Old Dominion University here that provides a program where those registered nurses who now either have an associate degree or a diploma are able to obtain their bachelor's degree in nursing. We can also offer programs for nurses with bachelor's degrees to move on to a Master of Science degree with specialties in education, also as a nurse practitioner. We have Southside Virginia Community College that offers a 2-year Associate of Science degree program here. I'm proud to tell you that right now, or at the very beginning, we had the first-year students here, and now we actually have both years of the program that are offered here. And we also have Danville Community College that works with the center to offer training for nursing aides. On the other side, not only is it a center to offer nursing education, but it also serves as a center to help local healthcare providers. I can speak to the part about the hospital, where we actually bring our nurses that are already employed with us to come down to the center where they can actually refresh their skills, learn new skills if we have new processes that we're putting into place in the hospital. And we also use the center to help train other providers besides their nurses in CPR, advanced cardiac life support. So it really serves two purposes for us. And one of the purposes that's not listed on this slide that I'd like to tell you about is the Center for Nursing Excellence also serves as a place that individuals who may be contemplating that they would like to enter into the healthcare profession can come down. They have someone there that they can talk to tell them what they have done so far in their education process and whether or not they feel like a career in a healthcare profession is something that they would be interested in. So it also acts as a counseling center, if you will. Now, just to tell you a little bit about the center, and I think you will be able to get a tour of it later. I certainly hope you'll be able to do that. But of course, we have a traditional classroom which houses 18 students, and this is where students can go in and actually get their theory part. Then they can move into the basic skill lab where they actually have mannequins. Now, I'll tell you, 35 years ago in nursing school, we had mannequins. We referred to them as dummies. Sad but true. But I can tell you, these are far from dummies. These mannequins can actually talk with you. They can be programmed to have any type of disease that we can have on a daily basis, and it gives a student an opportunity to see these things before actually going into an area of practice. It's amazing. The technology is amazing. Not only do we have the basic skill lab, but we have the advanced skill lab. And we use that more for the programs that involve the registered nurses and the nurse practitioners, and also for the pre-hospital providers when they come in to do their training. We also have a lab that is set up exactly as a home. As I mentioned earlier, with the need for nursing assistants and technicians to actually help care for families and patients in their home, it's just like walking into someone's living room or into someone's bedroom, and they are taught how to work with the patient in that setting. They actually have a debriefing area that after they have been into the skills lab, that they can come out. It's been recorded. They can go in, they can look at what they've done, learn from the things that they did wrong, and hopefully be able to improve their skills when they go back the next time. We actually have a birthing and newborn simulation as well, where you actually have the mother go through the birthing process. The student learns how to care for the mother and also for the newborn. And then there is a program called Virtual IV. Now, I'll tell you, there's nothing like actually touching someone to administer care, but this program at least gives you an idea of the anatomy and physiology that you're dealing with and the approach that you need to actually put in a needle into somebody's vein or to draw blood out of someone's vein. Again, it is amazing. So that's just kind of a picture of our Center for Nursing Excellence. Here are some statistics from the lab, the enrollment as of September of 2010. This is a type of report that is shared on a quarterly basis with the 16-member advisory board that helps to direct and guide the Center for Nursing Excellence in their undertakings and what programs need to be offered and what successes they've had. As you can see, as I mentioned earlier, you have the Community College from Danville with 113 nursing aid students, Halifax Regional Health System with 141 participants, and that's for, as I mentioned earlier, for nurses who come for additional training. When we bring in a new group of nurses every year for 2 weeks, we bring them to the Center of Nursing Excellence and have them go through scenarios with patients, because even though they may have been through a 2-year program, 3-year program, or 4-year program, there are some situations that they have probably never experienced in school. So we like for them to have that exposure before they actually go to work in our hospital. The Mecklenburg School Nurse Competency Training with 10 participants. Again, the ODU Family Nurse Practitioner Program with 2. Southside Virginia Community College Associate Degree Program, 127. The Southside Virginia Community College Practical Nursing Program of 77, for a total enrollment of 470 individuals. I will tell you that as an employer of healthcare providers and as a person who will need healthcare in the coming years, I'm able to lay my head on the pillow just a little bit easier at night, knowing that Southern Virginia Higher Education Center, in collaboration with their higher academic institutions, that we are able to answer the needs of what we need in healthcare for the future years. So I'm very excited about it. Hope you will get a chance to view it, and it's great.